Okay, Chapter 31, Part 2 of Infectious and Communicable Diseases. We're going to move right into the next infectious disease, and that is mumps. Mumps is an acute viral infection. It's caused by Paramyxoviridae family. It's a general infection with tenderness and swelling of the parotid and salivary glands. Patients with mumps are at risk of developing aseptic meningitis. It is spread through droplet transmission, so sneezing or cough. It is also spread by contact with saliva of an infected person. Treatment is supportive with acetaminophen and ibuprofen for the pain. Encourage the patient to stay hydrated and fed. EMS providers should not work without a MMR vaccination because those diseases, as we're talking about here, measles, mumps, and rubella, can be take a very good toll on an adult patient. Standard precautions: wear a surgical mask and thorough hand washing. Here's a picture of a child with mumps. And you can see the swelling of the parotid and saliva glands in this one side of this child's face. There is a question of potential sterility in men when young males get the mumps, and the swelling can be significant enough to possibly affect the airway as well. Rubella is German measles. It affects the skin and the musculoskeletal system and the lymph nodes. It is spread through inhalation from respiratory tract of an infected person or from their nasopharyngeal secretions. It's also spread from mother to fetus. Patients with rubella present with headache, low-grade fever, conjunctivitis, malaise, respiratory symptoms. A cervical post-auricular occipital lymph nodes are swollen and tendered. So the lymph nodes around the neck, around the ears and the back of the head, the occiput, are swollen and tender. The rash starts at the face and spreads down the trunk to the extremities within about an hour. And here is a picture of a baby with rubella or German measles. Highly infectious. Rubella, the hard measles, is highly contagious. It's caused by the measles virus of that family, and it affects the respiratory system, the central nervous system, the mouth, the pharynx, and it presents with a rash. It is spread by direct contact and droplets from the nasopharynx of an infected patient. The incubation period is about 8 to 18 days, and of course there is a vaccination that would prevent you from getting that. Prodromal symptoms associated with measles include hacking and cough, conjunctivitis or an inflammation of the conjunctiva around the eyes, eyelid swelling, sensitive to light, high fevers up to 105, Koplik spots on the buccal mucosa of the upper lip or just opposite of the molars. The rash itself may first be behind the ears, the forehead, and in the hairline. It spreads down and over the trunk and the abdomen, and it reaches the feet by the third day. It appears thicker over the head and shoulders and begins to clear and follows the same pattern towards the feet. The rash itself lasts about 6 whole days. There are secondary infections that certainly can occur when a person has measles, to include laryngitis, inner ear infection, myocarditis, damage to the eye if the virus gets in the eye, pneumonia, subacute sclerosing panencephalitis, which presents with drowsiness, irritability, seizures, and coma. There is no cure for the measles, but there is a vaccine. So here is a picture of a child that has the rubella rash inside their mouth, their buccal area. Pertussis is also known as whooping cough. It's a very forceful cough. It affects the oral pharynx. It's transmitted by airborne droplets of an infected host. And in the catarrhal phase, it presents as an upper respiratory infection. In the paroxysmal phase, which could last anywhere from 2 to 4 weeks, You get an episodic sudden onset of coughing. The coughing can be extremely forceful. Cyanosis, tongue protrusion, diaphoresis, salivation, lacrimation, vomiting, syncope, and apnea. In the convalescent phase, which is the final phase of pertussis, the cough lasts for weeks to months. You should be cautious of patients with a sudden onset of cough, practicing good universal precautions. There is a vaccination, and booster doses recommended, and it's important in EMS that we do keep our immunizations, vaccinations, and boosters all up to date. Other viral diseases include influenza, and influenza is one of the most common infectious diseases. It affects the respiratory system. It comes in influenza A and influenza B. Influenza B causes regional widespread epidemics every 2 to 3 years. Influenza C rarely causes epidemics. So these influenzas, these viral diseases, are why we get our flu shots, to protect us from influenza A and influenza B. Influenza spreads through the air and through direct contact with an infected person. The influenza virus can live outside the body for several hours in low humidity, low temperature. There is a different vaccination every year to cover the different strains that they believe we're going to be exposed to. Now, the thing, how that works is that influenza begins in the southern hemisphere and works its way north. So, prior to flu season here in the United States, there are people that have the influenza virus in South America. And knowing what strain they have, manufacturers can prepare the vaccinations for us so that when it does reach North America that we have been vaccinated. And oftentimes they're right and sometimes they're wrong, and they make a vaccination that isn't covered by the strain or type of influenza that we're seeing. But at least you have antibodies from other influenzas that may help protect you should you be exposed to the influenza virus. Fevers can be really high, 102, 104, headache, chills, muscle aches, sweaty, sick to your stomach, joints are stiff, you're fatigued, you don't feel like eating. You may have upper respiratory symptoms or a non-productive cough, sore throat, nasal congestion, nausea, vomiting. So it resembles the flu. Influenza treatment is supportive. There are some medications that can be given, but that would be in the hospital. For us, it's standard precautions, meticulous hand washing, wearing masks, those sort of things. Mononucleosis is another viral disease. It's an acute disease caused by the Epstein-Barr virus. It is part of the herpes family. It affects the oropharynx, tonsils, lymphatic system. It is extremely contagious. It's spread by oropharyngeal secretions in saliva, and as a result of that, you see it most frequently in young adults, ages 15 to 25. It has an incubation period of 30 to 50 days, and because it is spread through swapping spit, it's also called the kissing disease. Finding is a fever, a sore throat, oropharyngeal discharges, lymphadenopathy in the cervical lymph, conjunctival hemorrhage, and splenomegaly, or an enlargement of the spleen. Here's the conjunctival hemorrhage, where you've got bleeding in the conjunctiva, which you might see with the mononucleosis. Other viral diseases include sudden, non-feverish viral diseases like laryngitis, rhinitis, pharyngitis, all considered upper respiratory infections. Croup, bronchiolitis, or bronchitis being lower respiratory tract infections. Acute febrile diseases, viral diseases with fever, could be tonsillitis. Croup may or may not have a fever. Bronchiolitis, bronchitis, pharyngitis, pneumonitis, all may or may not have much of a fever. The primary virus responsible is the parainfluenza virus types 1, 2, 3, and RSV. And we see RSV commonly in children, much in the early winter, late winter, early spring time. In Japan and certainly in Europe, you'll see patients wear surgical masks throughout the entire influenza season for fear of getting RSV. Well, they wear it for fear of getting RSV, but then they also wear it to protect themselves from SARS, and that's not something that we see a lot of here in the United States, but it's quite common in Europe. Treatment is to make sure that you certainly take standard precautions, vigilant with hand washing, that sort of stuff, as we already mentioned. Sexually transmitted diseases. A quick recognition of a sexually transmitted disease prevents complications and the spread of the disease, but to determine that, you have to diagnose the disease and then determine the sexual history of the person who acquired the disease, the number of partners, the gender of their partners, whether or not they use contraception, and the menstrual history in women as well. One of the first sexual diseases that we're going to talk about is syphilis. It's caused by a spirochete bacterium, Treponema pallidum. It starts as an ulcer at the site of inoculation, and if untreated, it progresses through secondary, latent, and tertiary stages. Syphilis is transmitted through sexual contact. If left untreated during the initial and secondary stages, it becomes highly contagious. Syphilis may present with genital lesions. Congenital syphilis occurs from transplacental infection of the fetus. People are at greatest risk during stages of heavy spirochetemia. 50% stillborn, premature, die shortly after birth if they get this congenital syphilis during the development of the baby. 50% of those are born stillborn, premature, or die shortly after. The incubation stage for syphilis is about 3 weeks. The bacteria adheres to and penetrates the epithelium, and as the bacteria multiply, they disseminate through the epithelium. Initially, in the incubation stage, the person may be asymptomatic. In the primary stage, you get a canker at the site of inoculation or the site of where the syphilis came into the epithelium. It's a painless primary lesion with a clean base and rounded, discrete borders. It has a rubbery consistency. It starts small as a red, hard papule that gets larger. It breaks down, causing a crater with an encrusted surface. The majority are genital syphilises, and if untreated, can last 2 to 6 weeks and usually resolves on its own. Syphilis secondary stage or secondary syphilis, the patient will have fatigue, malaise, fever, anorexia, sore throat, weight loss, a rash that may encompass the entire body. It can affect every organ system, and it's often called the great imitator because of that rash over the whole body and the symptoms. It certainly may look like something like the measles or rubella. Latent syphilis is when the lesions disappear. That can occur 6 months to up to 8 years. Early latency if the lesions disappear within the first year, and if untreated, the secondary relapse is at 90% in the first year, 95% in the following 2 years. And again, some people may be asymptomatic with this. Tertiary syphilis, 1 of 3 outbreaks appears years to decades after the initial infection. So it's a late benign sort of syphilis. It may affect the cardiovascular system. It may affect the brain, as in the case of neurosyphilis. Tumors or gumas in the mucous membranes, the liver, the skin, the bone, and the cartilage, weakening of arterial walls leading to an aortic aneurysm, damage to the central nervous system, the cranial nerves, the dorsal roots of the spinal cord, all can be damaged by neurosyphilis. Findings in this stage is headaches, seizures, alterations in mental status, cognitive impairment, not being able to speak or slurred speech, destruction of the optic nerve, so the pupil restricts to accommodation. It does not constrict to light. In other words, it's fully blown. In all stages of syphilis, it's treated with penicillin. Here are keratotic lesions on the palms of a patient caused by secondary syphilis infection. Gonorrhea is another sexually transmitted disease. It is the second most common sexually transmitted disease. It's caused by the Neisseria gonorrhea. It can directly affect the urethra, the anal canal, the pharynx, the conjunctiva. Differentials might include endometriosis, salpingitis, or peritonitis. They may mimic the same sort of symptoms that you see with gonorrhea. Some systemic complications associated with gonorrhea, not locally at the site, but within the body itself, include arthritis, dermatitis, endocarditis, and meningitis. Women, the most common site for gonorrhea is at the cervix. Can also be in the urethra, can be in the anal canal, in the pharynx. If gonorrhea is in the fallopian tube and the woman develops salpingitis, it can lead to ectopic pregnancy and infertility. In men, when they have gonorrhea, they have a thick, purulent urethral discharge that's quite noticeable, and it burns when they urinate. With women, they may have abnormal vaginal bleeding, abdominal pelvic pain, burning and painful urination. It can spread to the eyes by rubbing the eyes with infected fingers that can lead to blindness. Treatment is with an antibiotic. There is no cure. And so patients with gonorrhea, as with any patient with a sexually transmitted disease, it's important to use personal protective equipment. Chlamydia, it's the most common sexually transmitted disease. Complications include salpingitis, damage to the uterus or the fallopian tubes, increased risk of ectopic pregnancy, infertility in women, and in men, epididymitis, or an inflammation of the epididymis. Chlamydia is spread through sexual activity, sharing of contaminated clothing or wet towels, hand-to-hand transmission from an infected eye, secretions. After the infection, no immunity is acquired. The most common site of infection for adults is the urethra or the endocervix in women. For children, the most common site of chlamydia is the respiratory tract and the eyes. The most common symptom in men is difficulty urinating and urethral discharge. In women, they're asymptomatic but may have some urethral discharge as well. Conjunctivitis can lead to blindness, and chlamydia is treated with doxycycline and azithromycin, which are both very strong antibiotics. Here's a speculum in a vagina, and you're looking right at the cervix of a woman that has chlamydia, and you can see the white mucousy discharge. Herpes is another sexually transmitted disease. HSV1, 80% of the population has this herpes virus. It affects the trigeminal ganglia. And the outbreaks are usually in the oropharyngeal area. So herpes HSV1 is a cold sore. And again, 80% of the population is seropositive for this virus, and as a result, occasionally break out with a cold sore. The HSV2 affects the sacral ganglia, and it outbreaks in the genital area. After the initial infection, it enters a latent, non-replicative state and then eventually reactivates. Can be reactivated as a result of emotional stress, trauma, fever, ultraviolet light exposure, immunosuppression. I know in some people eating lots of sugary hard candies or suckers can cause them to get a cold sore. It's spread by close personal contact. It can be spread in the absence of cold sores. Major portals that gets into your body includes broken skin and mucous membranes. Herpes, newborns infected if the mother has active lesions during the delivery. Before the herpetic sore development, the prodrome is burning and itching. Systemic infection findings include fever, malaise, headache, confusion, fatigue. Again, much like syphilis, much like chlamydia, much like many of the infectious diseases. Treatment is the medication aciclovir. Prevention, avoid contact with infected secretions, wear personal protective equipment, avoid sexual contact, wear condoms or use spermicides, things that may help kill potentially sexually transmitted diseases. Scabies and lice are a parasitic infestation of the Sarcoptes scabii. It's a mite. Female mite invades the upper layers of the skin. A person may have a hypersensitivity or allergic reaction to the mite's protein and feces and develop hives. It spreads from person-to-person contact, can also be spread through sexual contact. Dirty linens of an infected person, the lice can live in those dirty linens for up to 24 hours. Scabies is in men a lesion on the finger webs, the thighs, the external genitalia, armpits, waist, and anterior wrist. For women, the lesions are on the nipples, the abdomen, the lower portion of the buttocks. For infants, the lesions are on the head, the neck, the palms, the hands, and the soles of the feet. Here is a picture of lice, and although it's extremely difficult to tell, right there, that whole thing right there is a lice. I see one for sure. That one right there. There's another one right there. There's one right there. So there's a person who has lice. It infests the head, the body, and the pubic region. Body lice are involved in typhus, trench fever, relapsing fever. It's spread by direct contact with a person or using the same item on your head, like sharing combs, that sort of stuff. Body lice, direct contact or indirect contact with infested items. Pubic lice by sexual contact. Lice leave a febrile host. Fevers and overcrowding favor the transmission. Lice don't hatch at temperatures less than 72 degrees Fahrenheit. Lice have a 3-stage life cycle. The eggs take 7 to 10 days to hatch. The nymph stage is about another 7 to 13 days, and then egg to egg about another 3 weeks. Treatment is topical medications, mechanical removal of all the eggs, the nymphs, and the adults from the body. Practicing again standard precautions, bag all linen, spray the inside of the ambulance with an insecticide known to kill lice and mites, and glove up at all times. Prevention, good personal hygiene, wash clothing and linens in hot water. Let's see. All right, yeah, wash linens in hot water. Lyme's disease is a tick-borne or an arthropod-borne disease. It's caused by spirochete bacteria in the deer tick. It affects the skin, the central nervous system, the cardiovascular system, and joints. Ticks are the vector of transmission, particularly deer ticks. In Lyme's disease, during the first stage, there's a localized reaction at the bite site. It's painless. There may be a warm rash. It may have flu-like symptoms, fever, chills, headache, malaise, stiff neck, myalgia, kind of looking like a meningitis. Second stage, early disseminated stage, the pathogen invades the skin, the heart, the nervous system, the joints, and multiple lesions start to show up on the skin. The seventh cranial nerve is affected, and it causes Bell's palsy, may involve the brain, causing a meningitis, may invade the motor and sensory nerves, producing a peripheral neuropathy. In the second stage of Lyme's disease, the heart may develop AV blocks. You'll have musculoskeletal pain, sore throat, dry cough, fatigue, lethargy, and a sensitivity to light. In the late stage, Lyme's disease. You can have recurrent arthritis that affects the large joints and knees, feelings of depression, sleep disorders, and then cognitive deficits in mentation if it causes a meningitis. With tick removal, it's important to grasp the tick as close as possible to the skin surface with the tweezers or forceps and gently pull it till it lets go. Don't crush, don't squeeze, wash the site with soap and water, dress it appropriately. Ticks are more prevalent in the summer and the fall or the peak season that they're available, and treat the patient compartments with insecticides. Here's somebody with Bell's palsy that has Lyme's disease. You can see paralysis of the mouth and droopy lid on the one side as well. Gastroenteritis is an inflammation of the stomach lining and the intestinal tract. Could be caused by rotavirus or Norwalk virus or an enteric adenovirus, parasitic infections, bacterial infections, or just an overgrowth of normal intestinal flora. Gastroenteritis can be transmitted through contaminated food and water. Is transmitted through the fecal-oral route. The patient is going to present with abdominal pain and cramps, diarrhea, nausea and vomiting, fever, anorexia, and just sudden shock. Gastroenteritis could be caused by H. pylori, which creates ulcers, and this is found in patients who have chronic gastritis, chronically suffer from what they believe to be GERD or heartburn, and upon further examination they find this bacteria H. pylori in their stomach, and rather than treating them with H2 blockers, they treat them with antibiotics. Differential diagnosis, gastroenteritis could be mistaken for salmonella poisoning, botulism, appendicitis, inflammatory bowel disease, or a bowel obstruction. Exposures to infectious and communicable diseases, when you're handling a potentially infectious material and it comes in contact with your eyes, your nose, your mouth, or your mucous membranes, or in non-intact skin, that is considered a significant exposure. Immediately report this exposure. There's a 3-page form that needs to be filled out. One goes to your service, one goes to the hospital where you're transporting the patient, and one goes to the State Department of Public Health. It allows for immediate medical screenings to see if there's any sort of medication that you need to be started on prophylactically. It permits the rapid identification of the infectious agents so that you can get proper treatment, and it's all handled locally by your medical officer within your service or your infection control officer at your hospital. Employers are required by law to provide employees with appropriate medical care when treatment, if they're exposed. So things like vaccinations are provided by the employer, but the employer needs to know that you've had a significant exposure when it occurs and not a month later when you develop the disease. As far as preventing disease transmission, if you've got diarrhea, draining wounds, wet lesions, body temperatures above 100, if you've got a positive mononuclear osis test, if you're jaundiced, if you have lice or scabies, or you've been taking antibiotics for less than 24 hours for strep throat, these would be situations where you wouldn't want to go to work, as you could infect your partners. Make sure that your immunizations are up to date, and these are a list of some of the immunizations: MMR, hepatitis B and A, diphtheria, tetanus, polio, chickenpox, and influenza or your flu shot. It's important that when we think about infectious diseases and sexually transmitted diseases, that we approach all patients with caution, understanding that all patients are infectious until proven otherwise. We want to control the scene. We want to meticulous attention to standard precautions, and always be cautious of risk to yourself, to your patients, and your coworkers. And should you receive a significant exposure, report it immediately. So that ends our Chapter 31 on infectious diseases and communicable diseases. And as you can see, there was quite a wide variety of them. Most of them had very similar signs and symptoms. So it's not going to be our job to identify what the disease is. It's going to be our job to treat the symptoms that we're seeing, as well as to practice personal protective universal precautions so that we don't spread these infectious diseases that we may come in contact with. So with that, we're all done with Chapter 31. I'll talk to you soon.